Julie Rovner, I think that's a name that policy wonks, at least in the room and on our Whova app, know well. Julie Rovner is the KFF Chief Washington Correspondent and host of the podcast What the Health, which I believe Julie started after the ACA. I might be wrong, but excited to hear more about what we're thinking about in terms of health reform and what's next more broadly in health reform. Julie.
Thank you so much. Thank you all for being here. As was mentioned, I'm Julie Rovner, Chief Washington Correspondent at KFF Health News, host of our weekly news podcast, What the Health, which we tape right directly over my head at this moment. And my desk is a couple of floors above that, so welcome to KFF. We don't have a lot of time for this session, so I'm not going to waste it other than to say that this year, I think, is unlike anything that we've seen in Washington. Certainly unlike anything I have seen in all of my years covering Washington, and I've been doing it since 1986. We have a great panel here, so I want to dive right in. First, I'm going to let each of them introduce themselves. Go ahead.
Hi, guys, or gals, and guys. I'm Slone Salzberg. I'm Vice President at Horizon Government Affairs, which is a DC-based health policy government affairs shop. We specialize in coalition building, so we've got the Council for Affordable Health Coverage, and then we do standalone client work from policy development up to lobbying on Capitol Hill and in the regulatory kind of space.
Good morning, everyone. My name is Gregg Girvan. I'm a resident fellow at the Foundation for Research on Equal Opportunity. We're a nonpartisan think tank that focuses on those at or below median income and wealth in the United States. And I lead our healthcare team and look to research policies that leverage the tools of individual liberty, free enterprise, and pluralism to forward those goals. I just want to say real quick that I'm very honored to be able to join you here this morning and to talk about these issues. It hits close to home, the stories that we hear. That's something that we've experienced within our own families, so really appreciative for everything that all of you do.
Thank you. Also very honored to be here. My name is Elisabeth Burak. I am with Georgetown University Center for Children and Families, and we're a policy research center with a mission to improve health care coverage for children and their families, primarily low-income children and families, which means we spend most of our time explaining and doing policy analysis on Medicaid and the Children's Health Insurance Program. So thank you for the opportunity to be here.
So we're just about exactly 2 months into this new presidential administration. I want to ask each of you, what has surprised you the most that has happened in these first 60 days? And what's the biggest health-related issue or maternal health-related issue that you're watching?
Everything? Let's see. What has surprised me? Honestly, the DOGE process, the Department of Government Efficiency, that has been, I think, the most surprising thing. I've been in DC for 15 years. I used to work on the Hill, and I've never seen anything like that. So that's number one. I do general health policy, so full disclosure, I do not focus on maternal mental health. While I care about it a lot, I used to be an ER tech. And I have lots of friends that have gone through lots of issues. I think general health policy, some of the things that I'm really focused on are in the prescription drug space. So that's kind of the area that I focus on.
Gregg?
I'll just echo what Sloane said, that the Department of Government Efficiency is obviously in the way that everything's been handled. I think everybody's still sort of trying to absorb how that whole thing is going. I would say, other than that, one of the things that I think is encouraging, if not surprising, is that health policy is part of the conversation. Coming into this year, my assumption was that the extension of the tax cuts was just going to suck all the oxygen out of the room. And while that is to some extent the case, there's a lot of talk about how we incorporate different ideas in health policy, especially things that are going to be cost savers for the government, to use as pay-fors in the reconciliation process. And that has gotten a lot of traction, in particular things like pharmacy benefit manager reform and site-neutral payment for Medicare, and we can get into those issues. But I think a lot of those types of issues are really getting a lot of attention, which I think is a positive sign.
I wish I could say the reconciliation efforts on Medicaid had surprised me. They really didn't, because we've seen that movie many times.
And we were given quite a preview of it.
Yeah. I think this is a little more nuanced, but HHS recently sort of released that they wanted to overturn decades of sort of practice of releasing public comments for new rules and sort of allowing public comment process to happen. That was surprising, because I think the public comment periods on new proposed rules and regs has been a really important way to influence policy at the agency level. So it stands to be seen exactly how that plays out, and where it plays out. But I think that was surprising to me, at least.
And I assume you're watching Medicaid mostly.
Mainly, yeah. But I think any of these rules, right? I mean, it's to the idea that you could put a rule out and it go into effect immediately and not have the sort of ability to have an open discussion and debate about it is surprising, just because that's been the process.
So I want to throw out the thing that surprised me the most in these first 60 days, which is Congress is basically swallowing everything that the administration is doing. I would have thought, I've covered Congress, as I said, since 1986. I worked on the Hill a little bit before that. I never would have imagined that Congress would have sat still while someone went in and whacked at NIH and the FDA and, other things that are bipartisanly, not just bipartisanly cherished by Congress, but whose every jot and tittle of policy is so chewed over by Congress, for Congress to just kind of watch and say, yeah, okay, you guys go. Do you think this is just sort of part of shock and awe that Congress at some point is going to say, hey, this is our job?
It's a loaded question. So
it's supposed to be.
So the first statistic I'm going to throw out there that I saw last week and kind of opened my eyes. Almost 3/4, I think it's like 69%, but I'm going to say almost 3/4 because I'm in policy and I frame everything. Almost 3/4 of congressional Republican or of House Republicans were not around during Trump won. So these are the new Trump, the new MAGA Republicans. They're not the old-fashioned Republicans.
Say that again? I had not heard that statistic.
Yes, almost 3/4 of House Republicans were not around during Trump won. So it is a new era of Congress. It's a new era of politics. We saw at the end of last year a very bipartisan omnibus, pay for or government funding bill in December that got tanked with a tweet. So
by Elon Musk.
It
wasn't even a Trump tweet.
Yeah. Elon Musk tweet. It was this super bipartisan. I mean, I worked with folks on the Hill on this and calling them the week after and just asking them, are you okay? And so we're in this new age of politics where right now they are all swallowing. Trump is kind of the guy. He's the one that's signaling yes or no. I don't know if anybody's following the DC stuff with the budget. Trump said yes, which is again surprised, or he didn't say no. And so maybe that'll go, maybe it won't go.
This would be basically requiring DC to cut its own budget. It's not even a federal saving. It's just let's make DC fire half of its teachers and firefighters and police.
And so anyways, we have this new politics, new age politics. I'll leave that at that. And then I'll add in the one other thing. I think if constituents are loud enough and it continues the way that it's continuing, maybe they will kind of raise their heads up. But for the time being, they're keeping their heads down and just following what the president is directing.
Adding to what Sloane was saying, this is a trend that we've been seeing now for decades. So we really shouldn't be entirely surprised that over time, Congress has ceded more and more and more authority to the president. And so this is, I believe, a culmination of that, and it remains to be seen whether Congress is actually going to eventually push back. We have to remember, too, that there's also the Senate, and the Senate is a little more temperate in these matters. And so, and that goes along with the reconciliation process that's going to go
Which we'll get to next
as well. Yeah. And so we really shouldn't be surprised that this is happening, but we also have to remember that a lot of these things are getting gummed up in the courts, and the courts are having their say. And so, how all of this is going to play out is really a big unknown. And I think for a lot of people, especially from sort of the MAGA right, that think that the Supreme Court is going to, do these big rulings on, the unitary executive and all these things that are going to give Trump all this authority, I think it is worth remembering that a lot of the Supreme Court decisions recently have been them basically shouting at Congress, do your job as it is laid out in the Constitution. Take back your authority. And so I think it really does remain to be seen how the courts are ultimately going to help settle all of this.
What do you think about Chevron, though? And
I mean, I think that's an example of, the courts trying to rebalance where the balance of power should lie according to their reading of the Constitution.
Somebody better give the 30-second. What is Chevron, or what was Chevron? Yeah. I guess is the operative question.
30 seconds. I'm not a lawyer. I'm a zoologist by training.
We did a whole podcast on this, by the way.
I'm not a lawyer either, so
listen to the podcast. So the what is it? TLDR is so Chevron was a court ruling that basically said, and again, don't quote me, that the regulatory process, so the administration, when you promulgate the rules, the proposed rules and the final rules, they were given too much power, and that the power really needed to be with Congress and the legislation, and you needed to follow the legislation, and the legislation needed to be more specific. And so it was moving power away from the regulatory kind of administrative branch back to Congress. Did I do an okay job?
So, obviously, I mean, one of the reasons that the Supreme Court keeps yelling at Congress to do its job is because Congress has very much not been doing its job for the last several years, with either Republicans or Democrats in charge. We could spend way more than a half an hour talking about that. Congress is out this week, as we're seeing by some of these town meetings that are and aren't being held. Yes, and traffic, that's right. But when members come back, they're going to continue to work on the budget resolution that could lead to a budget reconciliation bill that could cut Medicaid by hundreds of billions of dollars over the next decade. Given Congress's inability to actually get big bills over the finish line, handicap this and sort of, are people overreacting to these possible Medicaid cuts, or, which might not happen, or do you think that that's sort of baked in at this point? Why don't you start?
I don't think folks are overreacting on these cuts, if only because the potential is these cuts would turn back the clock for families, certainly for moms and babies. It's hard to overstate the magnitude of the cuts that we're talking about and what it would do to shift costs to states and make states have to make the decisions about what eligibility of services are we going to cut. That's not to say I think they'll get it done, but it will take a lot of education and all the reasons we've talked about of this new Congress and state leaders and others to make sure they're sending the message. This is handing a really big bill to states and could undermine a lot of progress, particularly for moms in our health system.
I'm going to offer a little bit of a different perspective in that the first thing I think we have to remember is that the cuts that are outlined in the Energy and Commerce Committee, this $880 billion that has been getting people worried about what's going to happen to Medicaid, this is the opening salvo, and the Senate has their say too, in terms of they have to put out a budget bill, and it's not going to be the same as the House, and then they have to reconcile, thus the reconciliation process. They have to reconcile the two bills. And so there's a lot that still needs to be played out. I think the second thing that we need to remember too, though, is that while Trump and the Republicans have committed to not do any cuts to Medicare in terms of benefits, that's also in Energy and Commerce's jurisdiction. And there are a ton of things that we can do that aren't going to cut benefits to people in the program, but could help the program run better and more efficiently. I mentioned before
Say site neutral payment.
this issue with site neutral payment where, you know, hospitals are charging people facility fees for going to a doctor's office just because they own the doctor's practice. It has nothing to do with whether, you know, they're using any resources from the hospital. And that could save billions of dollars right there without at all impacting, you know, beneficiaries, especially when you look at these spreads that hospitals have. And I'm sorry if there are any hospital executives in the room, but, you know, there's the spread between what they're charging for their prices, the many multiples of Medicare prices they're charging commercial payers versus what they would need to charge in order to break even. You would be astounded how big the spread is. And so there are policies like that that can help close that $880 billion gap that we really need to seriously consider and pursue, that I think would make the program work better. Similarly, and this is something, you know, for Trump and the Republicans, who, of course, are more ardent defenders. I mean, confession, as am I think, you know, Medicare Advantage has an opportunity to really drive a lot of value, and seniors really like the program, but it needs to run better. And we need to make improvements so that there's not the upcoding problem where the insurers are trying to nitpick every little, you know, condition and disease that the person really doesn't have, but they do so in order to get a larger payment. We need to tighten that up, and that's going to create a lot of savings too. So there's a lot of opportunities there.
Can I ask, Greg, is the Medicare changes not, I mean, I think those are important and on the list. Those don't get to due to 180 billion in the.
They're not going to get us all the way there. It can help. And I think, you know, one other thing I want to mention too, and a lot of work that we're doing at FreeOp is on a concept that would improve program integrity to make sure that people are getting the benefits that they qualify for. There's actually a lot of people who would qualify for things like Medicaid or SNAP or the earned income tax credit that aren't getting it right now because of things like the time tax. The amount of time it takes to even apply for these benefits is really restricting the number of people who can get these benefits. But at the same time, we could have something like a digital ID, which is actually used in other countries. Interestingly, and this is probably the only time you'll ever hear this country's name in any conference like this, but Estonia, this tiny country, has a digital ID where every interaction you have with the government is through this digital ID, and they have zero fraud that occurs in their system because it's not based on something like Social Security numbers, which, let's face it, based on the cybersecurity hacks that have occurred in recent years, everybody's social has been stolen at one time or another. And so there's fraud in our system that could be cut if we use innovative solutions that are actually fairly easy to implement, especially because here we have things like login.gov that we can build off of that would improve program integrity, but would also make sure that people who don't truly qualify for those benefits or are trying to get them fraudulently cannot get access to them. And so there are innovative solutions that can help us get there that would impact the Medicaid program, but not impact the beneficiaries' access. In fact, it would improve it and make sure that those who truly qualify could get access to it.
I mean, I think in concept, that's great. I don't know that we've seen a lot of evidence of fraud on the beneficiary side. Usually they're the victims of fraud, and it's provider fraud where the real problems are.
All right. Well, I want to move on because it's not just Medicaid that's prompting change. States with abortion bans are seeing an outflow of both practicing doctors and reduced inflow of medical students and residents. And it's not just OBGYNs and family doctors and people who deal with moms, but all doctors who are either worried about what happens if they or a family member might have a pregnancy complication that can't be safely addressed. Are there suggestions for how to address some of these workflow issues? I know that this is one of the big issues in maternal mental health. There just aren't enough providers.
I'll just say cutting Medicaid's not going to help that very much. And in fact, we know, especially in rural areas where this is a big problem, more Medicaid, folks on Medicaid, particularly kids and families, are more likely to live in rural areas. So that's just going to exacerbate those problems.
Yeah, I don't have much to add other than there's the doc fix, that's Medicare, that did not get done at the end of that last year. And so they're talking about potentially including that on some form of reconciliation this year. I also
Which would actually cost money rather than some of these other things.
We got to pay for that.
Money.
We got to pay for that with the Medicaid cuts, right? I'm just kidding. So I wanted to take like 2 steps back and just talk about what's going on right now. So we've got... Yeah, sorry. So we're talking about reconciliation, and I don't think this is not like a mainly DC room, is it? Or is it? No. Okay. So reconciliation, you've heard this term bandied about. It has special rules. So normally when you need a lot of pass, and actually I think Greg and Julie both kind of refer to this, we've gotten to a point in Congress and legislation where things don't pass on their own anymore. They're part of these bigger bills. You might hear this term must pass legislation or vehicles. And so you tack bills and policy changes onto these big moving packages. And then it's up to leadership, which is what Greg was referring to, where it's just slowly, we're giving more and more power over to leadership. And so we've now entered this world where things have to go as part of these big packages, but now we're at this time and space where we're talking about reconciliation. So reconciliation is a specific set of rules where you can only pass bills, laws that include direct spending on federal budget. So it has to have a spending piece of it. It can't just be a policy change. And you can, if you do that, then you can pass it with 51 votes, which is really important because there's only a 3-vote margin in the Senate for Republicans right now. And usually you need 60 votes to pass stuff. So the Democrats used reconciliation under Biden with the Inflation Reduction Act, which had a big change in healthcare for prescription drugs and the Medicare Part D space. And so now Republicans want to use reconciliation for the big, beautiful tax bill. And we're getting to this point of how are we going to pay for these permanent tax cuts? And so that is this debate, this $880 billion. They, might give the Energy and Commerce this basically amount of money that they need to come up with pay-fors. And that's where this Medicaid is potentially on the chopping block.
Minimum. That's a minimum for those instructions. Yeah.
That's right. And just to add two, people keep talking about all of these as budget bills, which makes me crazy because they're not. The federal budget has sort of 2 big pieces, the discretionary spending, which are the appropriations bills, and mandatory spending, which are Medicare, Medicaid, and taxes. And so reconciliation bills are used to reconcile the budget resolution to the mandatory spending program. So the spending bills are always separate. I might point out that in the current dysfunction, Congress is still working on fiscal 2025, both the budget resolution that they just passed, which was supposed to be passed last April, and the spending bills, which were supposed to be finished by last October 1st, but just got done last Friday. And of course, they didn't really pass spending bills. They passed a continuing resolution to continue the spending bills from the year before, which were itself a resolution to continue the spending from the year before that. And I forget exactly how many years it goes back. But, when you talk about how Congress is not getting its work done to the point that even the Supreme Court has noticed, Congress is not getting its work done. But I want to turn page a little bit because I don't want this to be a complete downer. If we ever see bipartisanship in healthcare again on Capitol Hill, what are some of the things that the federal government could do to improve things like provider deserts and, I love this word, administravia, things that everybody hates that just take too long but are, I guess, an attempt to prevent fraud?
as far as the administrative costs in the United States, it's well known that our administrative costs are a whole lot higher than in a lot of other countries. And our part of our work at FreeOp, we do this index each year called the World Index of Healthcare Innovation. And so we rank 32 high-income countries on their healthcare systems. And obviously, one of the big standout issues is that in the United States, we spend far more per capita than any other country on healthcare. But I think what's surprising to some people who, believe, and in some ways rightly so, we do have, at least some of our citizens have access to some of the most cutting edge care that exists in the entire world. And yet, you look at our health outcomes, and I'm not even talking about just life expectancy, which is influenced by a lot of other factors that aren't necessarily attributable directly to the healthcare system. But if you look at things like treatable mortality, which is directly related to those interventions with the healthcare system, we are middle of the pack at best. And that's shocking when you look at how much we're spending. And so in terms of what we could do if we ever get bipartisanship is we really have to deal with the value proposition. What are we getting for our healthcare dollar? And again, I don't mean to be negative toward providers because they're doing amazing work, and it's really amazing to have providers within your circle that really truly help you. I mean, my family's been very blessed by that. And at the same time, though, we really have to deal with this issue that we're spending so much more, and we're not using more services than these other countries are. Our utilization rates aren't any higher. In fact, in terms of stays in a hospital, our stays are often much shorter than these other countries as far as inpatient stays. So in the immortal words of Uwe Reinhardt, it's the price is stupid. We're paying higher prices, and we really are going to have to confront that because the biggest driver of our deficits and debt is healthcare. And we're not going to turn this ship around unless we really deal with how much we're paying per unit of service. We're going to have to confront it. And there are many different ways to do that I don't have time to go through. But it's something that we really have to tackle and address because we're spending far too much for what we're getting.
So I would actually agree with that. We need to do a better job understanding what we're getting for our dollars. And in Medicaid, there's a lot more going on with that in states, particularly around maternal and early childhood health for the first time. We're seeing more tracking of state metrics and states asking the healthcare plans that they're contracting with to do more reporting. We need not just what they're getting, but what those outcomes are. And I think we're a long way from really understanding how those dollars are being spent. My one caveat for you would be, I think for maternity care and for young children especially, and really for young children, we don't want to put a payment reform system that doesn't understand the developmental period between sort of pre, during, after pregnancy, and for sure early development, because you're not going to save money on kids, for example. So I think that's one of those things that some state Medicaid agencies are grappling with. How do we do this without inadvertently, you might need to spend more on kids to make sure they get the right things. But I think making sure folks like you all that are experts at the table who understand maternal health and what those needs are during that really vulnerable time in a family and early childhood development, that's what's needed to make sure that these health changes are done thoughtfully and the right way.
Yeah, I agree with both Elisabeth and Gregg. There's a statistic out there that says the average family of four will spend more than 40% of their income on healthcare by 2030. That's 40% of your income on healthcare. So it is the prices. My personal opinion is you've got the people that are developing the innovations, whether or not it's drugs, treatments, whatever, and then you've got the patient that takes the treatments. That delta, there's more and more people taking pieces out. And I think, each new everything in healthcare, it's always a new added, and we're not taking anything away. And so this value proposition, value-based care, outcomes-based arrangements, I think that is a potential future, because when we get to this world where we have these really incredible things with precision medicine, where we, test your diagnostics and we figure out your genetics, and you've got this cancer with this specific genetic marker, and we've got the perfect treatment for you, but it's only for you. How are we going to pay for that? And so I think just figuring out these middlemen, and I mean PBMs, but more than PBMs, all of those middlemen that are taking those little pieces out, we've got to make that more efficient.
All right. Well, we're almost out of time. I just want to sort of go down the panel really quickly with a prediction. Everything going to be okay in 4 years?
I would say that if you haven't read, there's this book called The Infinite Game by Simon Sinek, and he's a business expert and tries to help people to be more fulfilled at work. But I think we have to view healthcare reform as an infinite game. In other words, it doesn't have a beginning and it doesn't have an end. There are no winners. The object of the game is not to win, which is often how Congress acts, like my side's going to win. The object of the game is to keep playing. In other words, to keep improving, to keep driving improvements. So I think we need to look at it that way. And that's the perspective. If we have that perspective, then we won't get down as much when things don't go our way. We'll keep going and we'll keep pressing for reform.
I think that's a great place to leave it. Yeah. All right. Well, thank you all. We obviously could have gone a lot further, but I hope you've gotten at least a flavor for how things are right now in Washington.